Hello, I'm Dr. David McFadden from the Dental Implant Center in Dallas, Texas. For all you followers, welcome back. Today's topic is who is discussing your dental implant treatment? Who's discussing it with you? I know that a lot of trends in implant dentistry, the patients may not even get to meet the doctor who's doing their treatment. That doesn't seem fair to me at all. There's only one person in the room that can answer all your questions, and that's the doctor that's going to be doing your treatment. So the typical model has now become almost like a car sales lot, where you're dealing with a car salesman, but he really doesn't get to make any of the final decisions. That back and forth between the car salesman and the I guess it's the finance manager who's going to tell you, what the best deal they can give you, quote unquote. But I'm aware of the corporate model of this interaction. And typically it's a finance manager or an office manager that will sit with you and talk more about the finances than about the actual implant treatment. I guess they kind of assume that you know what implant treatment is and what you're signing up for, when in fact the average dental patient has no earthly idea what's about to happen to them. So in my practice, what I've developed over the years is a one-on-one approach with my patients, where we actually sit at this very desk and discuss the mechanics, the engineering, the biology of the implant treatment that I'm recommending. We also talk about the options. Maybe everybody doesn't want the Rolls-Royce or the fixed implant treatment, so we have to, in fairness, we have to discuss every option that's available to every patient. And I can assure you that this is not happening in 95% or maybe more than that of the offices where you're going in for implant treatment. Why is that? It's because they offer one treatment and one treatment only. If you don't pick that option, they won't be able to treat you. So they typically glaze over that one option that they offer, thinking that if they don't mention it, you're not going to ask any questions. So the other part of that is respect. If you're signing up for any very invasive or very expensive or both treatment like you're getting with full mouth implant reconstruction, the respectful thing to do is to spend time with the doctor. So again, I don't want to sound like I'm bragging about myself, because that's not the point here. It's the fact that I have respect for my patients, that I want them to have all their questions answered. I want them to fully understand what it is that the procedure entails, how long the procedure will take, what the expected post-operative recovery time is. And I also talk about the finances with the patient. Again, I know that makes me a unicorn in the industry, and I kind of like that title. But again, out of respect, even if a doctor talks about the nuts and bolts of the procedure, and you understand that, most of the time you're pawned off to a financial consultant or an office manager who will talk to you about the money. I'm not saying that those people are not competent, but I think it's a little cowardly for the dentist to not talk about the money with the patients. And I'll admit, in the beginning, I was terribly uncomfortable talking about money. But as I did it more and more, and I realized that the patients appreciated the fact that I was willing to talk about the money, I got more and more comfortable with it, and now it's a perfectly normal part of the conversation, as it should be. And why do I talk about the money with the patients? One, it's respectful, I think, but also there's many, many stopping points in implant treatment where you don't have to pay up front. You pay as you go in this office, which is another thing I didn't mention. I'll get to that in a minute. But there are good stopping points in implant dentistry. And even though it's wildly expensive, we can protract the treatment for up to a couple years. In many cases, not all cases, but in many cases, there are good biological and financial stopping points. And I have another video that's dedicated completely to don't pay up front for your implant reconstructions. There's a myriad of reasons, and you can search for that video. But the main point here is that if you pay as you go, many times it allows patients to do a better treatment than they would otherwise be able to afford. And hopefully, if you're good at financial planning, you can possibly pay for this as you go without being saddled with incredible debt at a high interest rate. So I hope that this helps you understand the difference in approaches to patient interaction and treatment planning. Thank you.